Good evening, everybody. Yeah, sorry for that technical hitch. This is something which is, I think, we all need to learn how to navigate that. Anyway, better late than never, they say. Now, today's topic is something which I think you all know that what the mind does not know, the eyes cannot see. So, mental health and this business is something which some of us are not very familiar with. We have with us this evening Dr. Florence Jaguga, who is a psychiatrist and an acting director of medical health and rehabilitative services at the Moy Teaching and Referral Hospital. She is a champion of healthcare worker mental wellness and services and serves as the chair of Employee Assistance Program at MTRH. She also sits in the Kenya Medical Association Physician Wellness Committee. She has over 7 years of experience in managing hospital and community based mental health projects. She has participated in developing mental health policy locally and internationally and has served as a consultant on several World Health Organization projects. Dr. Jaguga has also published numerous scientific articles on mental health and substance use. So, without wasting more time, welcome, Dr. Florence. And then just a comment for all the listeners and the viewers. Any questions and whatever that you have, please put them either in the chat box or you can raise your hand at the end of the topic. Florence, welcome to the talk.
Thank you. Thank you so much for the opportunity to talk about mental health, and we'll dive right in. So we'll start by defining what mental health is, and then we'll look at how common it is among healthcare workers, and then we'll look at why it's important to address mental health problems for everyone, really. And then we'll look at ways in which we can tackle mental health issues. And then finally, we'll look at work-life balance, especially for healthcare workers. And then we'll have a question and answer session at the end. Okay, next slide. So what is mental health? Mental health is a state in which people are able to cope with the stresses of life, because the stresses of life are inevitable and happen throughout the course of life. It's a state in which people are able to realize the abilities that they have within them, because we do have strengths within us. It's a state in which we are able to learn, which means to acquire knowledge from the environment. We are able to work well, because work is the business of people who are alive and on earth. And then we are able to contribute to our communities. So basically, we are saying that mental health is not just the absence of a mental disorder like depression or anxiety or substance use, but it's this state that encompasses all these things that we've listed here. Okay, next slide. And healthcare workers, much as they're the ones who are taking care of everyone else, are not exempt from struggling with mental health challenges, both the diagnosable mental health disorders, but also just, general mental health challenges. They are not exempt. And we've done studies here in the country that have shown how common mental health issues are among healthcare workers. And we saw this particularly during COVID, where we did a number of studies that showed how common that was. So one of our colleagues did a study that found that a third of healthcare workers during COVID had probable depression. Slightly more than a third had generalized anxiety disorder, and close to 70% had post-traumatic stress, probable post-traumatic stress. So those are really, really high prevalence rates. And then another study looked at rates among people in the reproductive health setting and found that 85% of providers reported moderate stress. We'll look at what stress is. About 10% had high stress, 65% had low burnout, which is really mental and emotional exhaustion, and about 20% had high burnout. So basically what this slide is saying is that healthcare workers struggle and experience a lot of mental health challenges, and they are not exempt, just like the rest of the public, and it may even be more than what the general public experiences. Next slide, please. And so also these studies have shown that females compared to males tend to struggle more with mental health problems. Although if you look at certain mental health problems like substance use, then it flips and we find that males tend to have higher rates. Doctors compared to other cadres, we don't know exactly why. Younger health care workers compared to older ones, maybe because younger people don't.
Hello?
Sorry?
Yes. Yeah, now could you kindly repeat? We lost you a bit there.
Oh, you lost me a bit. At what point? The entire slide?
Yes, please. Maybe just go through the entire slide again, please. Thank you.
Okay. All right. So when you think about the factors that are associated with mental health problems for health workers in Kenya, we find that females have higher odds compared to males, except for mental disorders like substance use, where males have higher odds. Doctors compared to other cadres have higher odds of mental health problems, but we are not sure why. It could be the nature of work. It could be their personality. We are not certain. Younger healthcare workers compared to older ones, it could be that, younger people face more struggles. Maybe they're still starting out in their career. Maybe they have less social resources at their disposal. We are not certain. And single healthcare workers compared to the married ones, of course, again, less social resources, which contribute to more, mental health issues. Okay, so these are some of the patterns that we are seeing in terms of the epidemiology for mental health problems for healthcare workers in Kenya. But of course, there is room to do more studies. For example, to even understand across the different specialties for doctors, which cadres are having more mental health problems. Is it psychiatrists compared to ophthalmologists? Is it surgeons versus pediatricians? We don't know that yet. And so there's room to explore a little bit more and try and understand which specific cadres are affected more. Okay, next slide. All right, so why should we care? Why did your team invite me today to give this talk? Why do you keep on asking us to spend time giving this talk? Why are you concerned? Why should we care? Why not just ignore, this whole mental health issue? So we care because poor mental health is a risk factor for chronic diseases, and that has been established. And there's lots of evidence, scientific evidence to this effect. So cardiovascular diseases, cancer, gastrointestinal diseases, all of that has been well established, and that has been determined. So there's evidence to support that. Poor mental health is linked to reduced quality of life, significant social dysfunction, premature death, even from suicide, reduced productivity, you're not functioning well, you're not achieving your life's goals, there's no satisfaction with life, And so we care. We want to live a life that, where we want to be satisfied. We want to feel fulfilled. We care about the quality of life that we live, and we want to be happy, and we want to achieve our full potential, Si bora maisha, tunataka maisha bora, si ndio? And we want a healthy life. Okay. So we do care. So for that reason, it is important for us to pay attention to our mental health. That's one. But we also have a responsibility as doctors to be mentally well, so that we are able to be well enough to serve our patients. An impaired physician is not able to offer optimal care to the patient, and an impaired physician is also potentially harmful to the patient. A physician who is intoxicated is a risk and a danger to the patient. So also
Doctor,
there is the issue. Okay. You're losing me again? Are you losing me again?
sorry?
Are you
No,
losing me?
no,
Are you hearing me, or you're losing me?
You are quite audible, Florence. Please continue.
Okay. I thought someone said something. All right. Okay. Just alert me in case I'm breaking. And also, yeah, as I was finishing up, an impaired physician also poses a safety risk to the patient. So we care because of our own selves, but also because of, the sake of the patients that we care for. Okay, next slide. All right. So now that we have agreed it's common, and then we've also agreed that it's important, what are the things that we can do to support the mental wellness of healthcare workers? Okay, next slide. Next slide, please. Okay. So before we get to that, there's some definitions that I'd like us to go through to help us understand the discussion that's coming next. And that's the stress continuum. The stress continuum describes how we move from stress to distress to disorder. How we can transition from stress, okay, and how, if we don't deal with it by engaging coping skills, we can move to distress, or how, if we have severe prolonged stress over time, we can move to distress, and then finally to disorder. So stress is something that we experience in the course of our day-to-day, engagements with the environment, and they occur every day. So it can be someone stepping on your toes in the streets, it can be traffic, it can be someone throwing a rough word on the streets, it can be a tight deadline at work. It's all those things that happen that cause your adrenaline and your cortisol to go up. All those things that put a demand and threat on your body and that cause you to be alert, all those things are called stress. They put a demand on your body, okay? All those things are called stress, okay? And they demand of you to focus and be energetic. They cause your body to marshal all the energy that's needed to focus. All those things are called, are called stress, And usually we deal with stress by marshalling our coping skills, and we're able to handle the stressor, and the stressor goes off. We're going to look at that later, okay? So that's what we call stress, and that happens every single day of our lives, and it will never go away. If you want to imagine a life without stress, then that's in the grave, okay? That's when you're dead, because it's never going to happen, okay? And then distress, when distress arises from severe stress that your coping skills are not able to quickly switch off, and it's a bit more severe than the daily stress of a deadline at work, because usually a deadline will come and go and then you're back to normal. So that will be something that's above the daily stresses of life. So it can be a divorce. It can be the death of a loved one. You know, those things don't happen every day. It can be loss of social status. You've lost employment, okay? That's significant, all right? It's overwhelming. You're trying to engage your usual coping skills like taking a walk, but it's not going away, all right? Because it's quite significant, it's overwhelming, okay? And you require additional support with that, all right? And then all the way to when that distress is not resolving, and then that can transition into a disorder like depression or anxiety, or even to cope, you might begin to start using alcohol and drugs and end up getting a substance use disorder, all right? And often that requires medication and psychotherapy. So sort of keep this continuum at the back of your mind, because you're going to be drawing on these terms as we are discussing coping skills in the subsequent slides. So stress, distress, and disorder, okay? Next slide, please. All right, so what are the causes of stress for doctors? So you've said stress are the demands, the threats that are placed on us every day, all right? So the things that happen for doctors every day that cause a burden on us, okay? So in the workplace, it's the long working hours. Those things will never truly go away. We'll have long working hours all the time. We'll observe pain every day, okay? The high patient numbers will be there daily. That might never truly go away, okay? The lack of supplies is a frequent occurrence, okay? Maybe school and studies will go away, but you know that high workload may never truly go away, okay? Outside of work, we may have things like financial difficulties, the need to keep up with peers, loss of employment, financial difficulties. Some of those may be causes of distress as well, okay? But we have challenges that happen inside and outside of the workplace, okay? Personality, we may have challenges with our personality as doctors that may keep us very stressed and distressed as well. As doctors, the thing that gets us to the top is the same thing that also pulls us to the bottom as well. It's very interesting that what takes us to the top is also what brings us to the bottom. It's like a double-edged sword. The type A that causes us to be very hardworking and go-getters and very ambitious and wanting to, you know, to achieve and wanting to go for it, and perfectionists and very conscientious, is also what causes us to be very exhausted, you know, and very fatigued and very competitive, all right? And causes us also to tear at each other, right? So it cuts both ways and is a major source of stress for doctors, and causes us to also set things that cannot be achieved and very unrealistic expectations of ourselves, okay? It reminds me of a time when I saw a medical student who could not believe that he had failed. This young man, very brilliant young man, a student, who could not believe that he had gotten a supplementary, because all throughout his life he had always passed. Proper type A young man, but could not handle this one instance of failure because of the unrealistic expectations he had set upon himself. So it needed a lot of talking to help him understand, to set a little bit more realistic expectations. That personality that gets us to the top is also the same one that can bring us down. So these are some of the causes of stress and distress for doctors, both in the workplace, in the family and community, but also internal factors that I have and that we all have with our personality that can cause us a lot of distress. Of course, sijui kama inakuanga na chat. If there are others that you can think about, you can also type them in the chat or we can share them at the end. Okay. Next slide, please. Okay. All right. And the thing about stress and distress and mental health issues is that it's not as obvious as, say, a fracture or things that are, physical that we can easily see, or that you can image and see, pathology in the lung or in the brain. That's easy to see. But sometimes with behavior and with mental health issues, they're not as easy to see. And sometimes it's called the invisible disease because it hides and it can be very insidious. But if you're careful enough, there are things that you can see in your friends, in your colleagues, and there are things that you can see in yourself that can help you to know that things are not right. Either I'm stressed, or I'm distressed, or I'm sliding into the disorder phase. All right. Things are not fine. These are signals that my mental health is not fine. I am stressed, I am distressed, or I suspect I'm having a mental disorder. I suspect I'm having depression. I suspect I'm having an anxiety disorder, or I suspect I'm having a problem with alcohol. Okay. So changes in cognition is about how we, about thinking, So it could be that you're not concentrating anymore. You're not, if you liked to read, you have to read a paragraph multiple times before you understand, or a newspaper. You can't remember things. You can't budget as well as you used to. You need a friend to help you to plan, or you need a relative to help you to plan your finances. You're not, if you're studying, you're not completing your thesis as well as you used to. You can notice challenges with completing tasks, as well as you used to complete them before. Your mood is changing. You're irritable. You get angry very easily. And people around you can begin to tell you how easily angered you are over small things. If they're honest with you, they'll tell you. Or they will notice you're low. Your mood is low, you're sad. Okay? Or you get very anxious and fearful over things. Okay? Sometimes you notice them yourself. Sometimes it's other people who are noticing the changes that are happening with you. Okay? In terms of your behavior, you want to spend time by yourself, and you used to enjoy spending time with people. Okay? If it's work, you're not going to work as well as you did before. You're not completing tasks as well as you did before. Maybe you're getting into fights more. So there's a change. People can look back and say the past 2 months, you're not spending time with us. You're not calling home maybe as much as you did. You're not spending time with your friends. Maybe you're not going to church, or you're not going to Chama. There's a change in behavior. Okay. While maybe the first instance may be to, like in the workplace, maybe to punish, what we do, especially as EAP chair for myself, the first thing I prefer to do is to evaluate for a mental health condition, because I've learned that, where people could have gone through a disciplinary process, it ends up being a depressive disorder or even bipolar or anxiety, as opposed to disciplinary. There are people who've ended up going through treatment rather than a disciplinary process. Because if you look at a lot of these symptoms, you can see how they can be misconstrued to be disciplinary. If you look at unproductivity, absenteeism, violence, irritability, anger, inattention, you can see how they can be misconstrued to be disciplinary issues. Okay. And so, yeah, we encourage us to also observe this in our colleagues and support them to come to care. Next slide. Okay, so remember that continuum. When you're stressed, okay, and you've seen the signs of stress, a bit of anxiety, a bit of irritability at the end of the day. Those are the times you get home and you don't want to talk to anyone. You want to maybe even sit in the car a little bit and distress. It's a very nice thing to do. You get home, or you go into your room, whatever it is that your routine, whatever it looks like, spend a few minutes, just distress, whatever it is that, you know, however it looks like for you, calm down, you know. Those small coping skills are extremely important, okay? So these are some of the things you can do to distress. And remember, this is just for minor stress, for the minor stresses, okay? This is not for when you're severely distressed and overwhelmed, when it's prolonged stress or severe, like death of a loved one. This is just the minor stresses. You have a tight deadline, someone yelled at you in traffic and you're feeling stressed, or you've had a very rough meeting at work, and instead of coming to the house and kicking your wife or your cat, you'd rather get into the shower and take a long bath, or practice spirituality, or hit the gym. Because a lot of things happen that are negative because of poor coping skills, okay? Even from just having a very rough, you know, meeting with your boss, and then transferring it to your wife, who transfers it to the children and then the cat. You know, if that is transferred in a more useful way, it breaks down that chain of, you know, poor coping. So this is just for regular, you know, regular stresses. So you can take time off for leisure. You can do something you enjoy. You can work out, you know, social support, make sure you sleep, help someone out, say a prayer, you know, work out, just for regular, you know, coping skills. You know, you've had a quarrel with a partner, you know, those kinds of stresses. Taking some time to distress is extremely important. You know, you've come from an exam and it was stressful, okay? These things are extremely important to distress, okay? Very, very important. Or you've been having this feeling lately that your colleagues have left you behind and everyone has gone for fellowship, and you've been left behind, you're the only one with a master's. Then you can set realistic goals for yourself. Set what's within your reach, you know. What if you've set another path for yourself that doesn't involve doing fellowship? Okay, that's a different plan. Okay? So these are for when you're coping with sort of the minor level stressors. Okay, next slide. Okay. So what if you're a bit distressed? So when you're a bit distressed is when you're dealing with the more severe stressors. It's overwhelming. And when it's overwhelming, this is recurrent stress. Okay. So the anxiety is a bit on the severer end. Potentially symptoms like not sleeping. Okay. Maybe even a bit of palpitations. You know, you're finding it hard to eat. You know, there's rumination, there's worry. You're trying to engage some of the coping skills we've talked about in the previous slide, but they don't seem to be working. You're finding it hard to be productive. Okay. There are major decisions to be made. You're finding it hard to, make decisions, or major decisions need to be made. For example, many colleagues find themselves either having to deal with the major loss of a parent or a child, or divorce, separation, or heavy financial debt. These are the kinds of major things that we see with colleagues, particularly at that age, 35 to 50. Those are the kinds of things that we see with colleagues. Or also severe health conditions and diagnoses also are seen at around that age. So those are some of the major things that we see that cause severe distress. Okay, so not meeting criteria for a mental disorder, but there are also not small stressors that you can say, I'm taking a jog and I'll feel better, because the stressor in itself is a recurrent one. It's going to occur for a significant period of time, and it's causing a major shift in the life of the person who's struggling with it. At that time, you can engage some coping skills, but it's also important, extremely, extremely important, to talk to a counselor, a therapist, and see a psychiatrist. Okay, let us normalize talking to counselors and seeing mental health providers. Okay, we are not invincible, and we are human. And if we do not take care of our mental health, we are going to crumble. So it is fine to accept that we are human, and that we need help, and that we need people to support us to make decisions for some of the more difficult things that we struggle with in life. Okay. Similarly, if we suspect that we may be having depression or anxiety or a substance use disorder or any other mental disorder, then again, it's okay to see a counselor and a therapist. Okay. Also, at the time when we are thinking that we may be overwhelmed, at that time also, we don't know whether it's actually a proper depressive or anxiety disorder. We don't know. So it's okay to see that the psychiatrist, so that they can make that distinction, whether it's just distress or it's actually a mental disorder, so that they can decide what kind of treatment to give. Because at that time, you may not quite know where you fall, whether you're in the distress space or you've actually slid into the disorder space. And also the danger of sitting in the distressed phase for long enough. A lot of changes happen to your brain, including your frontal lobe, including your hippocampus. And some of those changes include atrophy from long-term exposure to cortisol. So the harm is bad. So over time, you're putting yourself at risk of things like even Alzheimer's. So quite important to seek treatment early. Okay. Next slide. Okay. So we've talked about what people can do, but what should I do when I see someone else needs help? Because many times people don't have insight. I may not see that I'm unwell. Okay. What should I do if I see my colleague needs help? Okay. We should be each other's keepers, because we've said it's invisible, and someone else may not be noticing that they are sliding down that path, or they may be too shy, or whatever it is that may be happening. So we should be each other's keepers. Okay. So offer to accompany your colleague to a psychologist or a psychiatrist. Hold their hand, book for them an appointment. Do not let someone slide down that path, down into the grave, and then later you come and tell me, Florence, I knew all along it was depression and alcohol. What's the point? Okay. So hold their hand and accompany them to the psychiatrist when you can. Okay. Offer to support a colleague in distress with practical issues. It could be childcare, it could be errands, it could be anything. Bring them a cup of coffee, offer them a hug, a meal, take them for a walk. It makes a difference. That kind of practical support makes a difference. Okay, so offer a colleague who's going through stress or distress some kind of practical support. That's also extremely important. Okay. Next slide. All right. So that's it for wellness. I will take a slightly different trajectory and talk about work-life balance. So slightly related, but talk about work-life balance a little bit as we wind up. Okay, just a few more minutes. So this is quite related to mental wellness again. We need to, we as healthcare workers, we have a tendency to focus a lot on work to the exclusion of life, because it's how we are wired. We are wired to love our work. We are wired to serve, and it's something we enjoy to do. We give of ourselves to care for others and to serve. And so work-life balance is something that we need to hear a lot of over and over again. And it's something that we have failed at a lot, including myself. I've failed at severally, and I've had to learn. I've had to put in a lot of effort also. So work-life balance is about balance between the demands of professional lives and life outside work. Next slide. Okay. So a healthy work-life balance means we are paying attention to all the important aspects of our lives. So life has multiple facets. So it's not just work. So we play multiple roles in our lives. So for example, as a female, it could be that as a woman in Africa, you could be a mother, you could be someone's sister, someone's daughter, you could maybe Mama Kanisa, you could be maybe the chama chair lady. So we wear all these multiple hats. You could have your role at work as well. We have all these multiple, you could be a wife. We have all these multiple hats that we wear, okay? So it's important to think about how all these roles interact and how you prioritize and assign your attention to all these different roles, okay? And how you assign your attention to all these roles varies during different phases of life, and it cannot be the same throughout life, and there's no one specific formula for balancing life for everyone, okay? Everyone chooses how they balance their life at different phases of their life, okay? So it looks differently for everyone, okay? And everyone defines it for themselves, okay? Next slide. Okay. And I forgot to add, you also have to think about hobbies, you also have to think about fun, you also have to think about your health. So there's multiple aspects to think about, okay? So So work-life balance is important because it brings about satisfaction, it improves health, it improves productivity, and also strengthens relationships and avoids conflicts. Okay, next slide. Next slide, please. Yeah, this is what I had said earlier. Health workers have a tendency of being consumed by work to the exclusion of, other roles that we play in life. Next slide. Okay, so how can we practice a health work balance? First, is to identify our roles, and these roles will look different from each one. Okay, you can see the different roles there: parent, spouse, manager, church elder, and they'll be different for different people. And then there are recreational activities there as well that can be different for different people. Okay, so you can list your work-life roles and responsibilities and list your recreational activities as well. Okay, next slide. Okay, so after you've listed all your roles and then you've listed your recreational activities, and then you set your priorities. Okay, what are the things that you value the most? What are you passionate about? What contributes to your purpose? Okay, what aligns with your strengths and resources? What makes the most sense to you? What is most enjoyable to you? Okay, then you decide those are the things that you're going to spend the most time doing. Okay, so for example, I'll just give an example of myself now that I'm talking. So for example, for me, being a mother makes so much sense to me and contributes to my life's purpose. So if I'm to allocate time to it, that would be something that would be a priority for me. So I would allocate time to it, for example, okay? Or being a doctor makes so much sense to me, or being a doctor makes sense to me, and so on and so forth. So that is how you would balance your priorities, okay? Allocating time, or I love gardening, allocating time to the things that you're truly passionate about and contribute to your life's purpose and vision, okay? So after listing all those things, then you allocate your time to the things that make the most sense for you, but that also align with the strengths and resources that you have. So that if you had listed hiking as one of the things you'd like to do, but you don't have the time and the money to hike, then that wouldn't be one of the things that you'd allocate your time to. All right. Okay, next slide. Okay, next slide, please. Okay. And then remove the things that take too much time. All right, the things that are not priorities, like social media. All right. Okay. Social media and gossip. Okay. Clearly saying no. Okay. Things that are, out of your limits or out of your boundaries. Okay. Because maintaining a healthy work-life balance also means saying no to the things that are not priorities for you and maintaining your boundaries, which is also another very big one and requires a whole other session of its own, because very loose boundaries waste a lot of times and prevents people from maintaining a healthy work-life balance. So loose boundaries are very, very good at draining energy and wasting a lot of time. Okay, so that has to do with time management as well. Okay, next slide. Okay. I think we said something about this. All right, next slide as we wind up. Okay. Also, workplaces can ensure that the working schedules are flexible. So that's beyond what individuals can do. The workplaces can also make sure they respect working hours, they give reasonable workloads. There's opportunities for team building, of course, within available budgets. They can allow work from home schedules. Basically, what I'm saying that there are things that employees can do, but there are also things that workplaces can do to also support work-life balance. Work environments should also be supportive of work-life balance as well. Okay. Next slide. So a couple of takeaways. Mental health is very important to the well-being of health workers. We cannot ignore it. It promotes overall well-being, quality of life, productivity and satisfaction. And the things we can do to promote mental wellness and work-life balance are really within reach. And it's okay for us to seek help if we feel overwhelmed. Okay, next slide. Thank you, and I'll take a few questions and comments. Back to you.
Dr. Walia?
Yeah, thank you so much, Florence, for that lovely talk and trying to clear the cobwebs in our minds about mental health and well-being. The chat box, somehow I can't see that. Anybody raising hand? Any questions? I can see my senior teacher who's there, Dr. Ashok Shah. Anybody else who's there who wants to ask anything? Dr. Shah? You need to switch on your mic, Dr. Shah. Yeah.
Thank you, Dr. Walia. There's not much that we need to ask, but one important thing that I've realized is temporary stress during surgical cases. When suddenly things go wrong and you get very much stressed, how to get over it has always been a big question. Florence, can you throw some light on that?
Stress during surgical complications during your work, Florence. Can you help with that remark?
Just say that again. Temporary stress post-surgery.
During surgery, one can have complications or some problems, and that causes the stress that you know. So how do you handle that stress, even if it's temporary?
For the surgeon or the patient?
For the
surgeon. For the surgeon. Mm-hmm.
Multiple strategies. I wouldn't say there's one single strategy that you can use for handling stress. A couple of strategies that you can employ to handle stress. I want to take you back to the slide that we had for handling stress. I don't know if you can share it again, Judy. Jerry, nonetheless,
and while Judy is trying to get the slide across, I saw Professor Karim's hand up. Professor Karim, you wanted to ask something? Prof, are you somewhere? Prof Karim, are you still there?
Sorry, sorry, I had just said thank you very much
Okay.
for the
all right.
presentation. It's a very good presentation. I wish we could also have those rights for purposes
Yes.
of reference. It is a good tool, and we hope that maybe we can even have such a discussion during the Congress so that the people who may not have attended this presentation can also have a chance of benefiting. It's a very important topic. Thank you very much.
I'm sure Mercy will have the slides available to anybody who wants them, or they can be even sent as an email attachment to anybody who wants them. Yeah. Anybody else wanting to ask a question? And Florence, have you thought of an answer to Dr. Shah's?
Yes. So we have 1,000 multiple different ways of dealing with stress and anxiety, not just one way. So many different ways of dealing with stress and anxiety. And I wanted her to pull that slide because I wanted you to see ways that you can deal with stress by certain ways by modifying how you think, and certain ways by doing an activity. I wanted to show you certain ways by doing activity. It can be distracting yourself by exercising. It can be having a hot bath. It can be riding a bicycle. It can be taking a walk. It can be reading a book. It can be journaling. It can be doing different things to deal with anxiety. So anxiety and stress can be dealt with in multiple different ways. It can even be deep breathing. And then the other way you can deal with anxiety is meditating. And meditation is the basis for what we call prayer in religion. What we call prayer in all these different religions, that's the basis for meditation. So that's one way of dealing with anxiety, or it can be with the deep breathing. So it's all these different strategies that you can use to deal with anxiety. If it is severe enough, which I doubt it is post-surgery, then you can move into the realm of cognitive behavioral therapy. But that is when now it is severe anxiety in the realm of an anxiety disorder, but we are not getting there because you don't have an anxiety disorder. So there's no one strategy for dealing with stress and anxiety. It's multiple different ways. That's why I was hoping she could show that beautiful slide with, multiple.
Okay, thank you, Florence, for that explanation.
Okay.
Anybody else with a question or a remark? Or we are all struggling still to clear the cobwebs? Yeah. Maybe the questions will come to you by email later, Florence, because some people might want to be private, right?
Yeah, it's fine.
Yeah. Okay. Yeah, so Judy has managed to get the slides across. Is this the one you wanted to see?
Yes.
Okay.
Yeah. And so say, for example, exactly like the second one, practicing gratitude is very good for when you're anxious post-surgery. So why are you anxious? What has happened post-surgery?
No, Florence, maybe I can rephrase the question that Dr. Shah. You see, sometimes when you're operating and you are expecting things to go okay from A to Z, I mean, you know what you've been doing, you're trained to do what you're doing, But during the course of the surgery, something happens, and this thing happens to all surgeons. I mean, something can go wrong, and when that happens, you know that something has gone wrong, and you have the capacity to deal with it, but it does cause a kind of a stress in you, and sometimes you want to ask yourself, why did that happen to me? So it's not a post-surgical something. It's something while you're operating. Am I right, Dr. Shah, in understanding that?
Yes, you're right.
Yeah. So Florence, it's something that, you're used to doing something. You have done hundreds of that case before. And while doing that particular case, something goes wrong, not due to your negligence, but the complications happen to every surgeon. So when the complication happens, it's like, okay, what has happened? And then it's like in the stress of what are you going to tell the patient? How are you going to sort it out, first of all? And sometimes you may be operating and you might find that, the tools that you need to kind of help you out may not be available. So it poses a bit of a stress, but yeah, because of your experience, because of your knowledge of the subject, you're able to close the case and the results are pretty good. But you as a surgeon, you know that something had gone wrong, and that can cause a stress inside you.
Yeah. And
Yeah.
I mean, I totally agree with you. I would call on any of these coping skills to cope. I would pick any of this. I would pick gratitude. So for example, I would tell myself, I'm grateful that my patient did not die. I'm grateful that despite that challenge, my patient came out alive. I would pick that one. And then I would pick social support. And I would talk to another ophthalmologist and talk to them about the case and debrief with them at the end of the day. And we would encourage each other. And then I would make sure I have a good night's sleep. And then I would say I would take enough time and rest the following day, or I would take some time off for leisure that weekend. And then I would set a realistic goal for myself next time and tell myself that not everything is within my control, that many times certain things are not within my control, that I can do my best, but things are not always within my control. And then maybe on Sunday, I would go to church and tell God, thank you for saving that patient. So these skills are so perfect for that situation.
All right, thank you.
Yeah.
I can see Lucy's hand up somewhere. Lucy?
Yeah.
No, I was just clapping, I think, because I
Okay.
think it was a very good presentation. Thank you so much, Florence, for that.
All right. Okay. Anybody else with a comment or a question? Professor Gishu is not here in this audience today, is he? No. Yeah. Okay. Yeah, Judy, you wanted to say something?
Good evening. I'd put the same question on the message box, just for Dr. Jaguga to tell us more about altruism as a coping mechanism.
All right, Florence, over to you.
Thank you so much, Judy. So altruism is about giving of ourselves to others, of our time, our resources towards helping another person or towards another cause that's beyond, that's not for our direct personal gain. So actually helping others helps us to feel better and helps us to cope with our own personal distress is rewarding. So for example, let's say if I have lost a child to heart disease and then I join the Matter Heart Run, it can help me to cope with the pain of losing my child to a heart condition. Or if I have lost a husband to alcoholism, and I decide to set up a rehab for free in the community as a way of giving back to the society. It can help me to cope with the pain of losing my husband. Okay, so that is altruism.
Okay.
So generally giving, those are big ones, but generally giving to the community, giving to causes in the community, or just giving of our time and resources is a very good way of coping, helping others. Like you could be stressed, but if you decide, I'm going to help a neighbor, help someone in the community, then you feel it helps you to cope. Works
All right.
very well.
Thank you, Florence. Thank you for that. Any other comments or questions from anybody? Well, if there are none, then I think we can, on behalf of the society, we would like to thank Florence for taking time for presenting this lovely paper and trying to clear some of the cobwebs that we had in our minds regarding this. And as I said, Florence, I'm sure some of us are going to contact you privately with our on your email or this thing, because maybe when we are sleeping it over tomorrow morning, we might come up with a question. So be prepared to keep answering questions for some time. Thank you so much, everybody. Thank you for this evening. Over to Judy or Mercy.
Thank you, Dr. Walia. Thank you, Dr. Jaguga, for presenting. Thank you, Dr. Walia, for moderating, and thank you all for attending. It's been a good presentation. I remember we had this during the conference, but it was a bit rushed. So I feel like today there was adequate time, and I've left her contacts on the screen in front of you for those who want to reach out to her personally. Yes, as for announcements is just a reminder about the conference, the OSK conference in November. Kindly pay up your registration and also hand in your abstracts for presentation during that conference. Otherwise, I'd like to end there. Have a good evening and see you next time. Kwaherini. Bye-bye.
Have a good week, everybody, and bye.